state of emergency, state of mind, what we're really talking about is how people's mindsets are while an emergency is happening and after an emergency. And we're looking specifically at not just the people who are first responders and the caregivers and the vulnerable populations that we're talking about, but also families and the community as a whole as they're going through this. So what I want to do now is I want to bring up for our last panel, which is entitled State of Emergency, State of Mind, the Copa Health CEO, Dr. Shar Najaf-Piper. And I'm being told they have to sit in a specific order because of how they have it on the technology. Executive Director of Fellowship Square and also a Copa Health Board member, Mr. John Scott Williams.
I think Shar stepped up in just a second.
She's right behind you.
And then from the Arizona Healthcare Association, Krsyten Dobson. And Kristen got here early. I was so happy about that. And then finally, a good friend of mine, somebody that I've known for 24 years, emergency management consultant, and a person who was the head of the Homeland Security Department for the city of Mesa, Gil Damiani. Welcome.
Let's welcome our panel.
So, we're just going to go and ask some questions, and not all of you will have the same question, but I'm going to try to make sure that we cover areas that I think are pertinent to the populations that you serve. I know the populations that Copa Health serves. Obviously, I know the populations that Fellowship Square serves. But Shar, the first question is for you. And one of the things that we really tried to do this year is to get away a little bit from the COVID-19 conferences we were having. We had planning for a pandemic. Dennis Dene was part of that. That was even before COVID. And then we had 2 or 3 of them that specifically dealt with COVID. So we're getting away from that. That being said, my question is, what lessons during COVID, during COVID-19, that we learned that you may be able to apply to other situations, small or large emergent situations with the populations that we serve?
I knew he'd pick me first, by the way. Typically does. But so before I dive into lessons learned from the pandemic, I do want to give a shout out to the Copa Health staff. It's wonderful to see everybody out. We certainly have had some iterations within this conference. This is the 10th year. Very exciting to be here. Apologize I couldn't open up the conference today, but happy to join you all. And we certainly have had a lot of lessons learned from the pandemic. One of which was just, let's just start on a positive note because this is all about mental health and the state of mind you're in during an emergency, which was to have a leap of faith. So in the beginning of the distress during the pandemic, it was really important for us to demonstrate resiliency and not fold under distressing times. And so here we are almost 3 years later, still having conversations around the ways in which we were able to approach that particular pandemic and ways in which we came together as a team. For us, it took leadership, really coming together, making sure that you're unified in your approach and your messaging, making sure that anyone that follows you, if you're a leader in any one of your institutions, them understanding that you have their back and vice versa, really making sure that they understand that during the tough times, you're not going to fold, you're not going to walk away, you're not going to do any reductions or furloughs, which were some of the conversations that were had. Fast forward to 2023, I think from a workforce development perspective at Copa, we're still having some challenges. And so getting very creative and innovative, which is another lesson learned, I think, during the pandemic that I wanted to highlight. It's important for us to be creative and not lose that spark or that innovation or that creativity during times of stress. So really coming together, making sure that there's a trusting environment, there's a psychologically safe space to be able to brainstorm, figure out creative ways in which to solve problems, I think certainly lent to our success during that time and still does to today. So.
Yeah, I actually was a big part of that. And the interesting thing is, it's hard to make other people feel safe, the members that we serve, if you're not feeling safe yourself. And I think that was a great message that we got out there at the beginning of the pandemic. So the next question, and this could go to all of you, but I'm going to start with John Scott. Many situations that we've talked about have to do with sort of a universal situation. Either it's a large scale pandemic like COVID, or it might be a mass shooting like they had up in Las Vegas 6 years ago, or the fires in Hawaii. But a lot of times, John Scott, you're dealing with tragedies that might be affecting a certain individual and the families that are around them. And my question is this: what kind of lessons can we take to apply to those individual situations when others may not be feeling the same stress that a family member might because a loved one's in a hard situation?
You have to think about that. On our campus, we have a email that goes on a regular basis that concerns what's happening on the campus. I'm the executive director. I'm supposed to know everything that happens. I don't. But without the email, I don't know if a person at the front desk, their mother or father just died, or if they're in and they're celebrating their 100th birthday. You can kind of tell, but you don't know. So communication, I've heard this today many times, is you have to communicate. Every day I get messages that tell me and tell my key staff who's here. We have a term, if someone dies, that they've gone to victory. And that lets us know to be appropriate in those people's presence. A lot of people will come in who are visiting who we don't know. These are family of the person who may have passed on. I don't know who that person is. So when they come in, I have to greet them in a way that allows them, if it is someone they're grieving for, that my appearance to them isn't disappropriate, because they assume I already know that mom died. Okay, so being sympathetic and being empathetic, but you have to do that with communication, and you got to let the right people know. So we do that on a regular basis.
I love the answer there, and I have to tell you, John Scott is an innovator. I've known a lot of the things that he's implemented out of Fellowship Square, and he is an innovator. But I remember during COVID, him telling me about the stress that was felt because family members could not be in person with each other. And I think some of the things that you did just were a great solution. And I'm hoping that they just continue forward in individual situations. So Krsyten, I got to make sure that Gil hands you the microphone. So, thanks, Gil. The Arizona Healthcare Association, mental health. I imagine that it's like every place else. It's becoming such an important subject that we're trying to address. But what do you see as far as being able to support the groups that you work with, the individuals that you work with, to promote a better, real mental health effort?
I think that speaks on a lot what that was said today, personal preparedness. You can't take care and provide quality care to the residents if you aren't in a mental state of mind. So taking care of yourself before taking personal time, making sure you're talking to therapy or doing whatever you need to do to take care of yourself so that you can provide the care that's needed to the residents. We saw one of the lessons that we saw during COVID was that the frontline staff needed more training from an emergency standpoint. They weren't getting from the leadership level. The communication wasn't being passed down. So they were the boots on the ground. They needed that training, and mental health was part of that training. So,
I really like that. It's something that I think was not, I don't want to say it was lacking before COVID-19, but it's really come to the forefront. And Gil, when you talk about your experiences, and you used to deal with a lot of larger scale things, but how are the lessons that you learned through Homeland Security, through your experience with the fire department, being implemented in putting out efforts to help support people with their mental health and organizations with their mental health?
Well, first of all, let me say one thing. I've known you for 24 years and you're still talking to me, so I must be doing something okay. That's a great point, and I'm going to piggyback on what Kristen just said, because it really, and Maddie said it too, it really does boil down to what can all of us do to minimize the effect of a disaster as it relates to a larger emergency, and people being able to come to work and being available to do what they have been trained to do. One other area that I think that we've hit on today in a couple of different areas is the fact that there are systems in place and people should be trained to understand and speaking the same response language, like the ICS training that we talked about and that a couple of you expressed interest on. And then also maybe there's another disability that we don't always think about, and that is the possible geographic disability of some people that live in remote areas that may not have access to the resources that we have here in the Valley. And they're not that far away, but that is a definite possibility. And again, things that we can do to address that.
Talk about that for a second, Gil. You've got a helicopter ride in the future. Why don't you tell the folks what you're going to be doing?
A week from today, I'll be down in the Supai village training the tribe down there in ICS, and we're doing ICS 700 and 100. So it's basically just scratching the surface of the system. And when you think about limited resources, that's what made me think of this geographic disability. There's 300 to 400 tribal members. I'm sure they have extremely limited resources. They are not going to operate a system like they would here in the Valley. There are they do have disasters down there. They have flooding, significant flooding at times. 11 or so years ago, they had to evacuate the entire village, which is about, I said, 300 people. So there are some things that need to be addressed. I'm not fully aware. I'm trying to educate myself on some of the issues that they are dealing with currently. But I'm sure I'll learn some things while I'm down there.
So, Kristen, speaking of ICS, before we move on, for the last 10 years, we've been educating our nursing homes on Incident Command System. Talk a little bit about that initiative and why, we've got representation here from Friendship Village, Tempe, Fellowship Square, Archstone is in the back. Long-term care is finally at the table when it comes to emergency management.
Yeah, I think that took some years, but thanks to the Disaster Ready program, we have implemented Nursing Home Incident Command, and Gil and Stan do a great job bringing that to the table and bringing long-term care in so they can speak the language and be ready to assist if there's a need. They have beds, they have staff, so I think it's important that they know the language and can practice for various incidents. It's not just your fire drills you have to worry about. It's the fire, it's the flooding, it's cybersecurity, it's various different things, and it took a long time to get that across.
When you talk about incident command-based training or the incident command system, I mentioned earlier, I think all of you that you were here, that I first became involved in this because I met Gil and we went through the incident command-based system. But I realize now that a lot of the core tenets of that can be used for mental health emergencies too. And let me give Shar and John Scott an example. It's not always a large scale, and I've already mentioned that a couple times, but it might be a significant thing that happens in your organization. A key employee passes away, or a key member passes away, and there's a lot of people that are affected by that. And under incident command, you would sort of rally together. But Shar, specifically, tell me with Copa, the attitude about embracing that process of trying to make sure that people are taken care of, even though it seems like it might not be directly affecting them.
Certainly. So at Copa, for those of you who don't know our service structure, we have social services, which essentially is all of our housing programs. We have members residing in our group homes. We have employment and day programs for individuals with intellectual developmental disabilities and behavioral health conditions. And then we have traditional integrated outpatient clinics serving members who have both comorbidities related to behavioral health conditions, seriously mentally ill, in addition to medical conditions. So I share that because we do have across the spectrum, quite an array of complexities in a member's care. And so at any given time, we do have a lot of grief and loss that we experience. We have trauma, we have vicarious trauma that's experienced from our staff. And during, especially again, going back to the pandemic, there were a lot of EAP that was being referred out within our organization. And although I hope there's no EAP providers in this room, although EAP is great, it's touching the surface. It's just barely connecting our employees or our members who are working as it relates to any of the mental health conditions or distress that they're under. So we had to get very, again, creative and innovative in ways in which we are connecting with our employees. So we looked at internally, what do we have as it relates to our structure, our programming. We were just starting to have an APA doctoral training program pending, wherein we have postdoctoral fellows that we're currently providing services to members who were receiving services out of our sites. And so these are docs. They were pending getting either their PsyD or their PhD, and they were providing all this service to our members, but yet not to our own employees. And so we took that group and we said, what if you came and did an on-site EAP light type of program for any and all of our employees who were going through those kinds of distressing situation? And it was a beautiful movement, if you will. We had quite a few postdocs that came together. They started having quarterly types of group sessions with employees wherein they just started enlightening individuals that we employ around a variety of different mental health topics. And then they would also be deployed to any one of our facilities wherein we would have one of these types of events occur. And it's still happening today. I highly recommend, if you don't have the resources or ways in which you can have that type of capability executed, look internally, look within your partnerships, your community, internal, external stakeholders, because there are a lot of things that we were able to do just by looking inward.
Yeah, I mentioned before about having a champion for emergency preparedness, having a champion for, keeping an eye and a hand on the pulse of how people are doing is also very important. And, I always have to be careful, John Scott, when I start talking about the new norm, because I think people are going to expect another norm to pop up next to me. But things like the difficulty in hiring right now, the stress that is being put on the caregivers that are having to work too much or work hours that they're not expecting, and how that might relate to the members that they have or the patients that they have or the residents that they have. How is that type of thing being addressed with your organization?
I think everybody in here is short-staffed. Is anybody fully staffed? If you are, I want to know your magic potion, because it just isn't happening. On the day that COVID hit, the first time that there was a person with COVID in our building, 30% of my staff didn't show up. Another 30% were very scared. The 30% that didn't show up, they weren't cowards. They were concerned, because at that time, nobody knew what we were dealing with. And nobody in this room knew what we were dealing with. I was of the flavor that it's like the flu will be gone in April. But it didn't. It went on for 3 years. That 30% that didn't show up was because many of my staff are Hispanic, first-generation Americans, and they have their parents at home. Well, this will kill their parents. And we were told it'll kill the kids. So do you want to go to work, or do you want to save your family? That has still penetrated the market. And you can see there's so many people that are looking to work remotely so that you don't have to put up with the disease. But the mercy is still necessary. Now, what we did is I took the first vaccination shot, again, whenever no one knew what that would do. Some people, we still don't know what the outcome is. But I am of the generation that if I want my crew to do it, I'll do it. So I took the first one, and we were the example. Other people set the example, and we persuaded. I didn't mandate. I persuaded And over 99% of our crew voluntarily got the shot. I had people who were conscientious objectors, and I was able to find ways that they could still work on the campus. Because remember, they were working the year before the virus, showing up every day, and all of a sudden they became the enemy. They didn't become the enemy. They were my saviors before we had a vaccination. So why should they have to change? So I found ways that I could work with them so that they could, in good conscience, continue to give mercy to my residents. It's hard to do. And I don't give anybody bad marks for COVID because nobody knew where it was. So whatever your position on that was, we still have a workforce that we got to bring back into a room with disease in it and people who are diseased. And it takes courage to do that. And it's not like I'm paying them $100,000 a month to do it. So, you have the pay. We are faith-based. We pray a lot. But everybody, every organization, every faith-based organization, every secular organization is short-staffed. So at this point in time, we're just going to keep doing what we're doing till something happens.
Krsyten, let's talk about the workforce a little bit more. The Arizona Healthcare Association, funded by Arizona Department of Health Services, we had a grant called All Hands on Deck, where we understand that Shar, Norm, other leadership from Copa is here right now. When the emergency or disaster happens at the hospital or the nursing home or the day program, leadership is not always there. Talk a little bit how we focused on frontline staff and how we've got to train them to think like an incident commander, to be ready for emergencies, because somebody's got to be in charge.
Yeah, I think that what we saw was we were putting on these nursing home incident command trainings across the valley, and we were getting the maintenance directors, we were getting executive directors, we were getting leadership, but that wasn't the right people in the room, and we saw that when the frontline staff had to put boots on the ground. They were the ones that had to be the incident commander during COVID, and they didn't know what to do. So they didn't know how to think like an incident commander. So we started All Hands on Deck, where we were training them to think like an incident commander. We partnered with NACA, our National CNA Association, and brought in leaders to talk about their experience with real life emergencies and how to get them to think like an incident commander and get them the training that they needed, because oftentimes leadership's not in the building when emergencies are happening. It's them that have to take charge and get other people involved, tell them what they need, get the logistics, get operations, and make sure that the emergency is handled the right way.
Gil, real quick, talk about one of my favorite stories that you share. It's about ICS. It's about the structure involving a wildfire and a sacred mountain. How does faith sometimes come into these types of situations?
I did some. I've been doing some trainings here on tribal land in the last 8 months or so, and I had 2 archaeologists in the training in San Carlos, and one of them came up to me and said, the reason I got into this is there was a wildland fire in northern Arizona, or in the Globe area, and it touched on sacred land, tribal land that we feel is sacred. And she wanted to pray on the mountain, for the mountain. So she went to the incident commander and asked for, I forget if it was his or her, but the permission to go up on the mountain and say a prayer. And for whatever reason, it was denied. So she wanted to get a better handle on how these decisions are made. Where do the politicians come into this? And I'm telling Noah about a flood as I'm talking to all of you, because you know how all that works. But again, somebody that is unfamiliar with the system, unfamiliar with the process. I can't tell you why the incident commander denied that request. to pray for the mountain. It might have been an access issue. It could have been a safety issue. It could have been a lack of resource issue. I don't know. And I didn't ask her, and she didn't offer to tell me. But that's one of the things. It's who should understand ICS? The answer to that question is pretty much everybody. Everybody should have a pretty good understanding.
Yeah, when you talk about understanding ICS, and by the way, at Copa Health, I've mentioned this several times today, we don't use acronyms. It's Incident Command System. And but when you talk about that, it seems as though communication and being upfront as much as possible is the best way to go. So, John Scott, who in your organization, if you're not there, has the ability to make the call on what people are told and what people are not told? I mean, you don't, for each situation, have a public information officer, but how do you deal with that?
It would go to the most senior person below me. That's who would do that. And we have training. We actually have training on that. And we have training for when the media shows up, what to do. And the receptionist has like 10 rules. And it's very important that we ask certain questions, and they know exactly what questions to ask. If it's media that we're wanting to come up, that's much easier. But it's very easy for things to be said. One thing that we've told everyone not to do is to say no comment. No one's allowed to say no comment. They're allowed to say, I need that information, and they'll point to the person who has authority as opposed to saying no comment. But that's part of our training. And it's usually a speech like, well, that's just something that the Mesa police are working on. We have an excellent relationship with the city of Mesa, and we want them to do a thorough investigation, and we're awaiting their results. That sort of thing. Thankfully, in 26 years, we've never had a disaster on the property. I've never had a fire. We've never been sued, but we have had thefts. And in the one situation, the person who did the stealing was a security guard, which is bad enough. He made the mistake of stealing from a lady whose son was a commander of the Mesa Police Department. But because of the technology we have these fob keys. It says date and time of who entered. In 24 hours, he was the primary suspect. In 48 hours, he was arrested, and now he's doing 6 to 10 for grand theft larceny, and all grand theft, and all the diamonds that he took were recovered because of the technology that we had.
Ed, you can applaud. So, it's interesting because we talk a lot about emergencies. I was talking to Stan earlier. He was asking me how my wife was doing because we're coming up on the 6-year anniversary of the Las Vegas shooting, and she helped out with some people there. But Shar, when it comes to a term that a lot of people may not have heard, but mental health first aid, where does that fit into this, and how does that get rolled out in an organization? I know how it does at Copa, but how would you roll it out in an organization, small, medium, and large?
Good question. Actually, before I got to Copa, we were having conversations systemically about rolling out mental health first aid to the schools. So, that was an area in which it took a lot of leadership to support that type of movement, that type of training. For those of you who have not gone through mental health first aid, just to give you a quick 30-second commercial about it, it is a very light training related to how you can identify, screen, and refer individuals under certain mental distress, and really making sure that you have the resources to identify when there are suicidal ideations or somebody who is going to be dangerous to someone else. And so it's a really easy, clean, I think, very friendly way to introduce the topic without being too heavy for a lot of individuals. So you really can roll it out to any institution. education. I was one who advocated for junior highs and high schools, training it for kids as young as 12 to be able to identify it within their own peer group. And as we've seen from the pandemic, we certainly have had a peak, unfortunately, in the amount of completed suicides for youth. So it's really important for us to familiarize ourselves, not all be licensed psychologists, but certainly have some level of awareness that it is existing and it's amongst all of us. I don't know one person, family, or friends who has not had somebody who's been affected with some kind of mental health condition. And so it's here, it's the reality. It's just a matter of getting comfortable with it, having a certain level of awareness, and then knowing when to refer when appropriate. And so mental health first aid is predominantly supported by a lot of various institutions, whether small, big, or medium or large. I would recommend going to ADHS. They have information, as does Access on their website, as does any of the health plans in the state of Arizona. They're really big on making sure that everyone has that information. And certainly at Copa, we can refer you to.
So I wanted to make sure, because I'm not going to ask too many questions. Stan might have another one. But Krsyten, I just wanted to ask you one question, one follow-up before we open it up to the audience for questions. But when you're talking about something like incident command system and the training, I went through it. It's fairly easy to go through. When you're talking about mental health first aid, how do you see that being implemented with the organizations that you work with? Because you work with a little different population.
I think it's just continuous training. What we try to do is we provide it, and then we try to teach our members who are attending these trainings to incorporate them into their own buildings. So we can't get every employee at our trainings. So if we can get 2 or 3, then they can take that back and incorporate it in their in-services or when they have new employees join. And it's making sure that it's happening continuously, not just once and then they're done, they have it forever. It's continuing that training and coming back again and again.
Yeah, I like that a lot because we have all 1,400 Copa Health employees here. Wait, no, we don't. But we do have the ability to train the trainer. Stan, questions?
Well, Norm, I don't know if you were going to open it up to the audience, or I wanted to maybe just finish it up by putting the 3 that have been here all day on the spot and say, what's your biggest takeaways from today? And then maybe have Dr. Shar put a bow on this whole thing. All right, Gil, you got a minute.
Let me start.
Tell us what your biggest takeaway was.
As I say, with every one of these preparedness conferences and readiness conferences, it never ends. It's not like you're building a house and you start today and 6 months later you're done. It's a continuous process. And the other thing is collaboration. If you see somebody here that you don't know, share a business card.
I think mine's personal preparedness. We can preach and preach and preach and say, continue to get educated, make a plan, be prepared. But then I think of my own personal life, and I don't do fire drills at home. I don't know that my children know what to do if we have a fire. I know they're getting that at school, but just personal preparedness and having a plan and making sure that plan's communicated.
For me, earlier I was talking about the problem our community was having with homeless, and a group of people over here said they can help me with it. And I thumbs up. I've been looking for someone to help me with that, and I was eager to find out who could help me with it. Now you have to know I'm past chair of the board of Copa Health, but Copa Health, City of Mesa Outreach, can help me with that. We're so big, I had no idea we were doing it. And the solution, I could have called Shar. Okay, so that's my biggest takeaway is sometimes it's already provided for you. You just have to ask. So.
All right, commercial. I like that.
I don't even, is it working? Yes. for me coming in, by the way, I'm in no way, shape, or form a veteran like Norm with this conference who facilitated this 10 years ago. For me, this is the 4th year that I've been a part of this process. So thank you to Jeff, to Norm, who really introduced me to this concept, who've continuously been really teaching me about ways in which we can get better prepared during an emergency. And there's been so many iterations that I've seen from year after year after year, and a lot of it is just what we're experiencing in this room. So I have yet to experience 1 year wherein I haven't learned something from one other stakeholder that's been a part of this process. And so, as someone said, Rome was not built in one day. And so we certainly can't know it all, do it all, but this is a great start. And so thank you to everybody who's been a part of this process and who continues to help us.
Thanks so much, Shar. And I have to just say, just to sort of end the conference here, I do want to have everybody stand up and give a special shout out to Jeff Baer. I was told 3 or 4 years ago I need to learn how to delegate, and Jeff has really stepped up and pushed this forward. He still comes to me with questions, but I'm just so proud of the work that he does. And also, the final thing, I heard an actor once say that acting isn't acting, it's reacting. And I think reacting is what these conferences really help us with. We cannot know if a comet is going to come down and hit in the middle of this room in 10 minutes. But we can know that we've been talking about how to handle situations like that. And I think that is so important, whether it's, a medical emergency, a widespread emergency, or a mental health emergency. And I just want to thank everybody once again, especially those repeat attendees. And we hope that you all will come. This is the largest that we've had so far. We had 200 people. We maxed out the system signing up. We had over 130 people show up today, and I think that there was such a great feeling towards it that we're going to just keep growing this. So thank you so much.